What about thinking back when you were Commissioner of Health in New Orleans? I mean, do you see health departments being able to work directly with Google to help the fact that, a lot of these health departments just aren't well resourced and they really do need help? Is there some connection there that you're thinking about?
Oh, we're doing that. Yeah, I mean, when I was, the expression I always have for when I was health commissioner is that, we did it with 2 nickels and some friends, and it's not that far off, And New Orleans Health Department is small and super under-resourced, and it's, in much better shape because the people there have just done an amazing work. My team when I was there, and they've continued that on. So it's in better shape, but it's still incredibly under-resourced and doesn't have, teams that can ingest big data and analyze it and create data visualization tools. I mean, just as an example, a lot of the, especially local health departments are that way, but some state. And so as we've thought during the pandemic about how we could be helpful, those are some of the kinds of tools that we've offered. So let me use the search symptoms trends as the example, but I'll give you 2. That's the first one I want to use, because one of the first things that I said to our researchers here when I got here was, when I was health commissioner, to get information about the pulse of my community, of what they needed, I could look at very stale epi data that had been collected 2 years prior. So that was a rear view mirror look. Then I would sit in church halls and community centers and drink stale coffee that we brought, whatever, to talk to community and figure out what was on their minds. I often say that what I learned in those first few weeks as health commissioner is that what the data said was people were dying of cardiovascular disease and cancer. And what people told me when I talked to them was that people were dying of violence and lack of economic opportunity. And those things actually do relate to each other. The allostatic load from those issues relates to developing cardiovascular disease. There's biologic plausibility there, but I wouldn't have seen that if I hadn't been able to talk to them. So I said to the teams, is there a way to get just cross-sectional data from search that would tell a local health commissioner what their community is thinking about? And that's what search symptoms trends is. That's what they've built. It's much more sophisticated than I could have ever imagined, but it's that idea that can we create an anonymized set of data that would tell a local health officer in the last day, and then comparing to the last 3 years, this is the kinds of things on the top of the mind of your community. So that is a tool available, but we also knew that it would need to be, we'd need to create the data visualization tools, and we'd have to support and help. So we've done that as well. Now, the more concrete way that we've been working locally during the pandemic is, wow, there's so many examples, but I'll use the exposure notifications as the example, and that's definitely more at the state level than local. But what we heard from local health officers was we need to do contact tracing, we need to scale it. People are not answering their phones when we call them. Can you help us? And so working with Apple, we created this digital contact tracing tool that augments the work of regular contact tracing, augment being the operative word. It doesn't replace. And lots of story about that, but it's this idea of these brilliant engineers realizing that Bluetooth low energy is a really pretty good way to see who's been within 6 feet for more than 15 minutes of which phone has been close to another phone, and you could use that as an anonymous way to notify people of exposure. So it would protect privacy, it would give information to public health, and it would be a technology that public health would know. In fact, when the engineer said, would Bluetooth low energy be an option? I said, I don't even understand what you're talking about. Like, you have to explain this to me. And they said, well, we're just going to build this API, blah, blah, blah. And I said, okay, well, we're going to have to back up and really get the glossary out and make sure everyone understands. We did. I mean, I lost count, honestly, Gary, but we talked to dozens and dozens of local health leaders, including at the county and the city level and at the state level and national associations over the course of months to explain to them what we could do, how it could be helpful, to get their feedback, to keep iterating. And we've been doing that still, of course, across the pandemic. What that builds is not just a tool called exposure notification, but has built relationships. So now our company has first name, in the trenches experiences with health officers and with public health trade associations like ASTO and NACHO, these, the alphabet soup of the really important groups that represent those health officers, that we can build on for the future. And that coming out of the pandemic is what I'm super excited about, because we did help. We want to keep helping, but we need to do that with them, is the point. Like, we can't just build it in a vacuum. And now we've got these really strong relationships forged, and we're speaking similar language, and I'm excited to see about what we can do next.